The SI joint is one of the biggest shock absorbers in your body, and it doesn't require a lot of movement to do so. It only has about 4 degrees of rotation and 1.6 millimeters of movement. While it doesn't sound like a lot, if it gets jammed up, it can cause a lot of low back and hip pain. The joint capsule is found between the ilium and the sacrum. We want to rule out the pain coming from the L5-S1 disc and from the piriformis pressing too much on the sciatic nerve. Regardless, we want to work that piriformis, that glute med, the TFL, the hamstrings, and the muscles in your low back. If a patient walks in with low back and hip pain that radiates into their thigh, it doesn't mean that it's always SI joint dysfunction. It could be piriformis syndrome, or it could be an issue with their disc between their L5 and their sacrum. If that's the case, we'll ask them, hey, where's it hurt? A lot of times they'll point right to that SI joint. After that, we'll do a series of orthopedic tests and neurological tests to make sure that it truly is that SI joint dysfunction. 50% of the time, this condition presents because of trauma, like landing on one foot or deadlifting without bracing properly. Our treatment starts with motion palpation to make sure that the joint's restricted. Then we move on to our adjustment where we break that restriction. Next, we move on to some soft tissue work. Here we're working the TFL, but we'll move on to the piriformis, glute med, and all the other muscles that we mentioned. Finally, we'll stabilize the hip complex with rehab, and we'll send you home with some exercises and stretches. Recent studies show that SI joint dysfunction changes how you walk, run, and balance on one foot. If you want to perform at your best, you don't want to live with this issue.